Hello, I'm Heidi Durhammer, and this is my Capstone project on menstrual health literacy and adolescents. I will be exploring how education and healthcare can better support early recognition of hormonal imbalances. To start, this topic is important because many adolescent girls experience symptoms like pain, irregular cycles, and heavy bleeding, but are often told, it's normal. This normalization can delay diagnosis of conditions like polycystic ovarian syndrome and endometriosis by years, and this impacts daily life, including school and overall well-being. So early recognition becomes critical. Menstruation is actually recognized as a vital sign, meaning it reflects overall health. But in practice, there's a gap. Adolescents aren't consistently taught how to track cycles, recognize abnormalities, or know when to seek care. And that gap starts with how education is structured. Menstrual education exists, okay? Nobody is questioning that. However, it is inconsistent, and it's often limited to broader biology courses and basic reproduction and health class. What's missing are practical skills like cycle tracking and symptom recognition. Without those skills, adolescents may not understand what their body is signaling to them. This gap is also something that I've seen personally. When adolescents don't have the tools to understand their bodies early on, abnormal symptoms can be ignored instead of investigated. Through my experience in the wellness community, I've seen how this lack of awareness contributes to long-term suffering. It's what drives my passion for preventative health and helping people feel confident knowing when to seek care. My academic background helped shape how I approach this. My background in chemistry helped me understand that hormones are signaling molecules that communicate throughout the body. My coursework in communication and ethics helped me think about how we share health information and reduce stigma. Together, these shaped my approach to holistic preventative care and my goal of becoming a naturopathic doctor. With that perspective, I developed my research question. My research asks how schools and primary care currently address menstrual health literacy and what improvements are needed to support earlier recognition of hormonal imbalances. From that, I developed my central argument. My thesis states that improving menstrual health literacy supports earlier detection of hormonal imbalances and better long-term health outcomes. However, current approaches are not standardized. Clinical discussions are inconsistent, and education lacks focus on practical skills that teen girls need to understand their menstrual cycles completely. Because of this, symptoms are often normalized instead of investigated. To explore this, I use a three-part research design. First, a review of scholarly sources, clinical guidelines, and education policies. Second, an anonymous survey of parents and guardians. And third, integrating both to identify patterns, gaps, and recommendations. Here's how I collected the data. The survey was distributed online to parents of adolescent girls. It focused on education experiences, healthcare discussions, and knowledge gaps to capture real-world perspectives in the current time frame. From this, several key patterns emerged. Overall, education is present, but it lacks depth. Healthcare involvement is inconsistent. Home communication is strong, but doesn't always translate into action. And stigma and lack of knowledge remain active barriers. One of the clearest patterns in my survey was that education itself isn't completely missing. Most adolescents are learning something about menstruation in school, but what they're learning is often limited to anatomy and reproduction. It answers what a period is, but not necessarily how to understand it as a health indicator. So there's a disconnect between awareness and application. Students may know menstruation exists, but they aren't always given the tools to interpret what their body is experiencing or communicating. And that same disconnect appears in healthcare settings as well. This was actually one of the most surprising findings to me. Even though organizations like the American Academy of Pediatrics and the American College of Obstetricians and Gynecologists recognize menstruation as a vital sign, conversations in primary care are really still inconsistent. Some adolescents are asked basic questions during well visits, but deeper discussions about cycle patterns, pain levels, or irregular symptoms are often missing. In fact, at least 42% of survey participants reported that these conversations were not happening consistently. Even more concerning, 33% of parents reported that menstrual health was not discussed at all during their daughter's well visit. And that matters because adolescents may assume their symptoms are normal simply because no one explores them further. So even when healthcare providers do bring up menstruation, the conversations are often brief and reactive rather than preventative and educational. At home, however, the dynamic looked somewhat different. Communication at home was actually one of the more encouraging findings in this study. Many parents reported feeling comfortable discussing menstrual symptoms with their daughters, and many daughters also felt comfortable having those conversations at home. But despite that openness, there was still uncertainty around what symptoms may actually require medical attention. Only 59% of parents reported feeling clear on when to seek care. So there's still a small, noticeable gap between being able to talk about menstrual health and knowing how to act on it. And that gap directly connects to the barriers participants identified next. One of the clearest themes in the survey was that the biggest barriers were personal discomfort and lack of knowledge on menstrual health. Some families may want to have these conversations, but they don't always feel equipped with the information or confidence to do so effectively. What stood out to me, though, was that participants overwhelmingly supported more practical education. In fact, 100% agreed adolescents should learn skills like cycle tracking and recognizing abnormal symptoms, and 94% preferred a combined approach involving schools, healthcare providers, and families. So the issue isn't a lack of willingness. It's actually a lack of consistent support, guidance, and coordination across systems. And that becomes especially important when we look at how symptoms are affecting daily life. Another important finding was how common symptom-related disruption actually was. Over 40% of respondents reported that menstrual symptoms affected daily activities more than rarely. These include school attendance, sleep, sports participation, and overall functioning. What stood out to me is that many of these symptoms are still normalized, especially in teens. Pain, exhaustion, heavy bleeding, or irregular cycles are often dismissed as something girls should simply learn to tolerate. Put up with it. But when symptoms become normalized instead of investigated, opportunities for earlier intervention can be missed. And that's exactly where menstrual health literacy becomes so important. The literature shows consistent gaps in education, delayed diagnosis, and inconsistent provider engagement. It also confirms that structured, practical education improves outcomes, and these gaps lead to real consequences. Consequences like missed early intervention, condition progression, and delayed diagnosis. They also impact emotional health and reflect a failure in recognizing patterns early. So, how do we fix this? The literature reinforces that menstrual health literacy isn't just knowledge. It's the ability to apply that knowledge and make informed decisions about your health. To address these issues in real-world application, schools need to move toward practical, menstrual-specific, skill-based education. This means going beyond basic biology and teaching students how to track their cycles, recognize abnormal symptoms, and understand when to seek care. These skills should be introduced early, reinforced over time, and taught as a dedicated content, not just briefly included within the general sex education. By doing this, schools can help adolescents move from simply learning about menstruation to actually understanding and applying that knowledge in their daily lives. In healthcare, menstrual health should become a routine and standardized part of adolescent care beginning as early as ages 8. Providers should consistently ask about cycle patterns, symptoms, and overall development, while also offering simple tools like symptom checklists, tracking resources, or educational guides to support early recognition of potential concerns. And even if menstruation hasn't started yet, the topic should still be introduced in an age-appropriate way. Providers can create space for open discussion by routinely asking both parents and patients if they have questions, and by including a consistent conversation about what to expect, what may be considered normal, and when to seek care. This helps normalize menstrual health early and creates a more preventative, supportive approach, rather than waiting until problems become severe. For families, the goal is turning communication into action. Parents need clear guidance on recognizing abnormal symptoms and when to seek care, supported by simple tools and open, stigma-free conversations. At the policy level, menstrual health education should be standardized and aligned with public health guidelines. This includes consistent curriculum requirements and support for implementation to ensure all adolescents have equal access to practical education. However, it's also important to recognize the limitations of this study when considering all of these recommendations. This study does have several limitations. The sample size was quite small, with responses ranging from 17 to 22 participants in the survey, limiting generalizations. The data also reflects only parent and guardian perspectives without direct input from adolescents. Additionally, responses were self-reported and participants were self-selected, which may introduce some bias. However, despite these limitations, the findings of the survey were consistent with existing literature, reinforcing the reliability of the patterns identified. This opens the door for future research. There is a need for more collaborative research that includes adolescents, healthcare providers, and educators to better understand how these three systems interact. Additionally, future studies should evaluate the effectiveness of specific interventions such as curriculum changes or standardized clinical screening tools to identify best practices. This would help move from identifying gaps to implementing and actually measuring real solutions. Overall, this work has broader significance. It's about prevention. When adolescents understand their cycles, they can recognize changes early and take action, improving long-term health outcomes. This project really reflects how my BAAS degree brings different areas together. My background in chemistry helped me understand the body more fully, especially how hormones act as signals, which affects how I see menstrual cycles as overall indicators of health. At the same time, my communication courses help me think about how we explain health information in a way that is clear, approachable, and reduces stigma, especially for topics like this, right? It's personal. And my work in philosophy and ethics helped me think about access and responsibility, making sure people have the knowledge they need to make informed decisions about their health. In conclusion, menstrual health education is present, but it is incomplete. Without practical application, adolescents are left without the tools they need to understand their own bodies, their own cycles. So coordinated, consistent approaches are essential to help further this understanding. Awareness alone isn't enough. We need coordinated action across schools, healthcare, and families to truly support adolescent menstrual health. Thank you for your time in engaging with this important topic.